Hello, and thank you for listening in. My name is Debbie Nelson, and I'm a Senior Benefit Consultant here at Extend Health. I am pleased to have the opportunity to spend some time with you today to share a simple framework for Medicare. Hopefully this will help you understand the options that will be available to you through Extend Health. By the time we're through, you should have some idea of the process so that you will know your next steps. Who is Extend Health? Extend Health is an independent company dedicated to serving Medicare-eligible retirees. We are not an insurance company. We are the industry's largest Medicare exchange, representing over 70 different plan carriers. Because of this unique relationship with the carriers, we can be objective. We don't have just one product that we need to enroll everyone into, one size fits all. You will have the opportunity to speak one-on-one with a licensed benefit advisor that represents several different plans in your area and is able to help you evaluate which one makes the most sense for you. Taking into consideration your individual medical needs, which doctors and hospitals you prefer, your lifestyle, and of course, your budget. We are here to help each of you make an informed and confident healthcare decision as you transition from your current group health plan into an individual plan. Our goal is to make this process a simple and positive experience for you. Here at Extend Health, we are experienced at helping people just like you. We have enrolled hundreds of thousands of participants. Our services are provided at no cost to you. We see here the names of just some of our many valued partners. Each day on the phones at Extend Health, we have the opportunity to talk to the retirees of such companies as Chrysler, Kellogg's, Avon, Whirlpool, just to name a few. And we are so pleased to add SuperMedia to our list of distinguished clients. Extend Health represents all Medicare plan types. When I say all, that sounds like there may be a lot, but really there are only two main types. The first one is a Medicare Advantage plan, and the second is a Medigap plus a prescription drug plan, Part D. Understanding the differences between these two Medicare plan types will make it much easier for you to evaluate and determine which type of plan you will want to select. Because you are coming off of a group plan, you have what is called guaranteed issue. We refer to this as your golden ticket to enroll in any Medicare plan that you feel will be of benefit to you without medical underwriting. No pre-existing conditions will keep you from enrolling in the plan of your choice. There is one exception. This is ESRD, end-stage renal disease. If you have ESRD, please mention this first thing to your benefit advisor on your enrollment appointment so that they may be able to recommend the appropriate plan for you. Both Medicare plan types can be equally wonderful depending on what you are looking for in a plan. Extend Health also has vision and dental plans available for you if that is something you feel will be of benefit to you. So now let me go into a little more detail for you on these options. Let's look at option 1, a Medigap plan plus Part D prescription drug plan. Medigap plans have names that are letters of the alphabet. For example, Plan F, which is the most comprehensive, and then Plan C, Plan N, Plan B. These are plans that have the same core benefits as a Plan F, but there are some copays and coinsurances associated with them. Medigaps are often referred to as supplements, sometimes also called a gap. All three of these names mean the same thing. A Plan F is the most comprehensive plan available. The premiums tend to be a little higher, but then you'll typically have no additional out-of-pocket expense when you use your Plan F. We refer to this as the pay-up-front plan. Medigap plans work side by side with Original Medicare. A Medigap picks up all the remaining amounts after Medicare has paid. This would include the remaining 20%, the deductibles, the first 3 pints of blood, and so forth. A Medigap has great portability. What I mean by that is that if you travel across the country, say in your motorhome, or if you have a second home somewhere, or like to go and visit the grandchildren for long periods of time, you can take your medical benefits with you across the 50 states. You also have limited coverage when you travel outside of the U.S. A Medigap also gives you more flexibility with your hospitals and doctors. Any doctor or hospital that accepts Medicare is usually happy to accept your Medigap. There are no network restrictions with a Medigap plan. You will most likely need a Part D plan to go along with your Medigap, and this will provide your prescription drug coverage. If you have veteran benefits or TRICARE for Life or some other creditable coverage, you would not need to get an additional plan. You have 3 different cards with this option. First, you have your original Medicare card. Second, your medical carrier card. And third, your Part D prescription card. There's one additional thing to keep in mind when enrolling into a Medigap. Most carriers do require that you pay your first premium at the time of your enrollment. If money is tight, you will want to plan ahead and budget accordingly. Option 2 is a Medicare Advantage plan. These are your HMOs and your PPOs, and typically have a network that you will need to receive your benefits within. HMOs especially have specific doctors and hospitals that you can get wonderful benefits from as long as you can work within the network that is provided. The minute you go out of the network, you no longer have benefits. A PPO gives you a little more flexibility to go outside of the network, but you do pay more. Medicare Advantage plans can be a great option for people who have been there and done that, and just stay close to home. It can also be a great option for those who are in good general health and want to keep their costs to a minimum. Keep in mind that if you go outside the network, say to go on a vacation, you would have emergency coverage with a Medicare Advantage plan. Be sure to ask your benefit advisor the particulars to the plan you're considering. We refer to this type of plan as the pay-as-you-go plan, as monthly premiums are typically lower than a Medigap, but then you have co-pays and co-insurances as you use your benefits. Medicare Advantage plans pay instead of Medicare, and you have just one card you present when you go to use your benefits, whether for medical or prescription coverage. I hope this brief overview of Medicare is helpful for you. If you have additional questions, be sure to jot them down on a piece of paper so that when you have your appointment with your benefit advisor, you will have the opportunity to have them answered. Now we're really going to have some fun. How many of you have ever heard your friends talking about donut hole? No, I'm not talking about a tasty treat that you have with your hot beverage. I am talking about the coverage gap. For those of you who have been on a group plan, this may be a new concept and it may sound a little perplexing. I will explain the thresholds for you so you'll understand how it's calculated, and then you'll be in the know next time you're out with your friends and the topic comes up. Okay, so the first phase of Medicare Part D is called initial coverage. Most of you will spend most of the year, if not all year, in this phase. You will pay your deductible and your copays until the total retail on your prescriptions reach $2,930, at which point you have reached the coverage gap, or the donut hole. Once you find yourself in the coverage gap, you will now pay 50% towards the cost for covered brand name prescriptions and 93% toward the cost of covered generic drugs, until your total out-of-pocket spent is $4,700 for the year. At this point, you have reached the threshold for catastrophic coverage. In 2010, those who found themselves in the donut hole had to pay 100% of the retail costs out of their own pockets, which was what caused all the commotion and financial hardship. With the health care reform law, the donut hole will gradually be phased out, shrinking over the next 10 years until it is at 20%, more in keeping with initial coverage. Let me give you an example of how reaching the donut hole could look. Let's say you take Lipitor and the retail price on your Lipitor is $100. We'll make it a round figure to keep it easy. So while you are in initial coverage, let's say you pay $35 and then your plan pays the remainder. You take some other prescriptions as well, and so sometime later in the year, you have used $2,930 worth of prescriptions. You have paid a lesser amount because of your plan benefits. But now, instead of paying $35, you'll be expected to pay 50% of the retail on your Lipitor, and the pharmaceutical company will pay the remaining 50%. So now you'll be paying $50. Once you have spent $4,700, you've reached the threshold for catastrophic coverage. Now, that doesn't mean that you personally have paid that $4,700. It's the total of what you've paid and the pharmaceutical company, the retail on that. Catastrophic coverage is designed to give financial relief to those who are very sick and have extreme high-end medical prescription expenses. Under catastrophic coverage, copays may range from $2.60 to $6.50, with a maximum of 5% coinsurance, whichever is greater. There's no carryover from year to year, and so each year you start at zero again. But as I said earlier, most people spend all or at least most of the year in the initial coverage phase. Your benefit advisor will be able to tell you if the donut hole will impact you. Okay, so now you know all about the donut hole. Again, if you have additional questions at this point, and I'm thinking you might, jot them down so that you may discuss your questions with your benefit advisor. So now we'll talk about the enrollment process. The enrollment process is very simple, 3 steps. The first step is to educate, and that's why we're doing these sessions, to educate you about Medicare and the options available to you. But there's a second part of that education process, and that's when you tell us about you, what your medical needs are, your doctors, your lifestyle, and your budget, all the things that you'll want to consider while making your choice. Once you've had the opportunity to evaluate your options, we will help you make the choice that makes the most sense for you, and then begin the enrollment process over the phone. The last step is to manage your account. We are a resource for you, not only in making this initial decision, but also from year to year as you have questions and concerns and have changes in your life. Please think of us as your lifetime friend in Medicare. We will be here ongoing. Watch for the enrollment guide that will be coming to you in the mail soon. It will review much of the Medicare information that we cover in today's session. If you have a computer and would like to do some research on your own, please visit our website designed especially for SuperMedia retirees, www.extendhealth.com/SuperMedia. There are a couple of online tools that will provide information that will be helpful for you in making your decision. The first one is called Help Me Choose. There are a few simple questions that will help you narrow down your selection choices. The second tool is called the Prescription Profiler. This is an amazing tool that makes it very simple to select your Part D prescription drug plan. You'll input your current prescriptions, and then the system will make a recommendation on which Part D plan will best cover the specific medications that you take. The great thing about our website, though, is that you do not need to use it. You may just talk to your benefit advisor, and they will provide the same information for you. And this brings us to the greatest tool of all, your licensed benefit advisor.